Could we use the same technology that was tearing people apart as the #1 sexual well-being brand? Could we have a point of view to use that same technology to bring couples back together again? And a wheel that we typically use, this wheel was created by TBWA Unlimited, is one of the creative agencies that we work with. And we know we're onto a great idea that will likely go viral if it falls very squarely into one of these 4 buckets. Is it emotional? Is it shocking? Is it funny? Or is it cool? And we ask ourselves this whenever we get a creative. And I'll give you some examples. Dove sketches, emotional. First Kiss by Ren, shocking. It shocked the world, and if you read the comments, they're still shocked. Evian Babies, funny. And Van Damme, Volvo, so cool. And you can't kinda fall into one of these buckets. You have to squarely fall into one of these buckets. And when we get a great idea and we know that it falls in one of these buckets, we have a lot of confidence. Actually, for a lot of our digital campaigns, we don't consumer test it because we've built our intuition and we know that this works. The second thing we ask ourselves is, would we share it? And this is when we make a creative more human. And we as marketers sometimes, if we put it off on a consumer, we can justify insights that may not really make a lot of sense. But if we make it a human insight, then it should move us too. And so we ask ourselves, would we share it? And if the answer is yes, how would we? If the only way we would share this, or we can come up with to share it, is look at this great campaign from Durex. We know we don't have a winner because real people don't really share that way. They go, oh my God, this is hilarious. This made me cry. This touched me. This moved me. And if we can come up with several iterations of how a human being could be touched by something, emotional, shiny, fucking, funny or cool, it's Durex, by the way. Hey.
That was not in the script.
That was not planned. It's in the psyche. I am on a sex brand, my bad. Funny or cool, don't mix those 2 words together. If the answer is yes, then you have a winner.
This is not about physical hardware necessarily. This is not about software solely. This is about a combination of those things, but also how we can work with our clients to create products and services. I say services because I believe that's a major component to this. Individual products are not going to solve this problem. If we look globally and the insights that we gain working as a team across 70 markets with 16 labs today and 10 more labs due to be spun up in the next year, we're gaining insights from these individual markets and sharing them. That's important for our clients because they don't want us to start cold when we're trying to ideate for them and come up with new things to do. If we talk about innovation and the process of innovation, we really fuel that through the global insights that we're able to collect and the sharing and collaboration, not just between technologists, but between doctors and healthcare professionals and caregivers and patients and people who aren't yet patients, but people with ideas. Ideas can come and will come from anywhere. And I believe that it's our responsibility to listen to those ideas and be able to take them and spread them amongst our clients so that they can deliver products and services to a global audience, maximizing the investment that they have across product and service development. So it's been really rewarding, I think, from a perspective of doing the work, because we're really actually, unlike many startup pitches that you see, we're trying to change the world. And I think we're starting to really actually do that.
For a lot of illnesses, your lack of awareness of what your body is doing is really important to getting better, isn't it? Particularly oncology, rheumatoid arthritis, those sorts of things. You don't want to be aware all the time of your data because that adds to your lack of health, and actually studies do show that changes how well you are and makes you iller. So I think along with this kind of technology becomes a huge responsibility on people like us to educate and make sure it's used responsibly and to help an increasingly educated populace really use technology in the right way and to own the responsibility for that. I think drugs companies, agencies, communicators, people like ourselves. It is up to us to make sure that what can go out of control is used in the right way. And it is not enough to be passive and say, well, it'll look after itself. Technology is there. Technology is something in this space that needs to be used for the human good by making sure that the control is there.
Last week, one of my sons was dumped by his girlfriend. Very cruelly, in fact. And he talked to us about it, and in fact, it emerged that it wasn't just that it hurt, because he was really hurt, it was the humiliation, it was the fact that everybody knew about it, his whole class knew about it. So be really relaxed about the fact I'm standing on stage now and announcing it to the advertising sector. Don't worry, Robbie, I'm not going to tell anyone who it was. But anyway, my point of all this was that as parents, we tried to explain to him that these things do hurt, they are painful, but that you learn from them, and you learn about your mistakes, you learn how to fall over, you learn how to get back up again. And in the end, this was going to serve him incredibly well as an adult, to enjoy all aspects of love, and that ultimately, for everything else that goes on in our lives and for all that we do, it's love that makes everything worthwhile. Now, I believe that getting to brand love is absolutely essential in our industry, and that purpose-driven marketing that really focuses on the consumer is the only way to get to brand love. It's not a new idea, we certainly didn't invent it, but it's been really hard in the healthcare sector to get there. And we absolutely depend on you. So that's my only closing message, is that we all have to be loud and proud about our purpose, innovate more, modernize the way we talk about our science, stay connected to consumers, take risks, and just speed up. But we depend on you to do it. So are you playing your part, or are you blaming the client and allowing us to accept mediocrity? Don't. Help us, challenge us, and let's together really change the way our sector that does such important work connects with billions of consumers all over the world much more effectively every day, because however damn painful it is, love is absolutely worth it. Thank you very much.